Good morning. This is Dr. Garais, and we are now going to go over. Last week I went over the EKG review on what's good to know regarding your EKG, and this week it's regarding phlebotomy. And again, since this is a procedures class, focus on, and if you look at, because since we had our labs in week 6 and 7, I put all the material here. Phlebotomy procedure. Now, what looks good on the phlebotomy procedure? Of course, remember the laboratory request form, what's important from lab, and the most important things are patient identifiers. And of course, the two main patient identifiers is, of course, date of birth and social security number. And also, the extra parts on the lab request form that also are really important is, of course, the doctor's signature, because the lab request form, all intents and purposes, is a written order. And written orders have to be carried out. And if you have a moment, you also document it on the chart as well, that the order was given at this and this time, and it was carried out on this and this time, and this date. Okay, explain the purpose. We did that. Safety needle holder. Now, you can ask the patient which arm is better, but you as the phlebotomist / technician should also assess as well. And if you recall from your previous classes, your phlebotomy class, you assess to see if there's any open sores, any open wounds, any defects, or anything that would prevent you from doing your job on that side on. Also, read the chart, because there could be instructions on where exactly to place the tourniquet and to place the needle. Note your anatomy as well. The three veins that we're going to hit, which is your median antecubital vein, your basilic vein, and your cephalic vein. And remember, thumb side is cephalic, pinky side is basilic. And of course, the median cubital, of course, is in the middle, in your antecubital fossa. Palpation in the vein, of course, gloving, and nice to know, but a little bit more difficult. 70% isopropyl alcohol is the antiseptic we use. Concentric circles, increasing concentric circles. You never go over the same area twice. Only removal of the cap when we're ready to go. We don't recap. 15-degree down angle with bevel up. That's a common question on your RPT exam. And remember, this is phlebotomy. We are shooting at a vein. You fill each tube, and don't forget, right after this, right? Don't forget to remove the tourniquet, whether you get blood or not. Okay, all right. So those are like the main stuff regarding the procedure. So let's now look at the collar top tubes. Okay. Now, this is a very comprehensive list on typical labs for typical tubes. And I'm going to go over the tubes and what I like about each tube. You need to know each tube and what's inside of it. If there's something inside of it, it is an anticoagulant. So, for example, lavender tube, the anticoagulant is EDTA. And the common test is CBC. Okay? All right? Those are the main parts of the lavender. Light blue is the anticoagulant inside the light blue. And every time I mention if the tube has an anticoagulant, therefore you have to tell me the additive. So the anticoagulant for a blue top tube is sodium citrate. Common test for a light blue is APTT, PTT, right? And that's an activated partial thromboblastin time with partial thrombin time. Okay. Now, what is this? This is a coagulation study. Okay. So light blue, think coagulation study, think PT-PTT. Right? And sometimes you'll see it as PT-PTT INR, International Normalized Ratio. Not all laboratories are created equal. So the PT-PTT numbers will be a little bit different in each laboratory. So there's this standard called INR that makes, it's kind of like a translation so that it'll fit a standard. So if ever you see INR for common test, that's a coagulation test. Light blue top. Green top, sodium heparin. Okay, I just done heparin, sodium heparin, lithium heparin, ammonium heparin. Again, another anticoagulant in the green top. Common test chems, your chemistry and ammonia. Okay, I always think of like ammonia, like ammonia in a green bottle. And of course, what's ammonia? It's chemistry, right? And what are your chemistry tests? That's your glucose, sodium, potassium, bicarb, your classic electrolytes. Gray top tube, right? I think gray, I think glucose. Okay? Sodium fluoride is the anticoagulant. So your fasting blood sugar, your GTT, your glucose tolerance test. FBS is a screening for diabetes, and GTT is the definitive test for diabetes mellitus. And I always think gray, sugar, glucose, gray, glucose. Now, tiger top tubes, red and gray, right, is an SST tube. But how do we know it is an SST tube? There's a silicate gel that's in the tube. Okay, all right. That's how we know, and that's not an anticoagulant. It does the exact opposite. We want to centrifuge it. We want the blood we want the blood to clot. That's why we put it in an SST tube. And again, chemistries as well. Red top tube, no additive, no anticoagulant. There's nothing in a red top tube. Again, we use those for chemistries as well. Yellow top tube, the anticoagulant is SBS. And yellow top, I always think CNS, culture and sensitivity. I always think, and yellow top has to go first because it's sterile. It's a sterile tube. So don't open it. Don't fuss with it too much. Okay? Even with a gloved hand, don't fuss with it too much. Don't touch it too much. Okay? Light green, and not so common. You do plasma tests. Orange, yellow, not too common, right? But royal blue, very common. We use it for tox screen, which is toxicology. Okay? Tan, and both royal blue and tan have EDTA and of course lavender. I put them all in one head. Tan we use for lead poisoning. And white, not too common. Pink, I always think hematologies, right? Whole blood. Okay. Now clear, I've never seen one use clear. So that's all this whole thing in a nutshell. You got to know the color top tube. You got to know the anticoagulant if there is one in there, and you got to know the main test that you use it for. Okay, and you also have to know that in real life. Okay. Order of draw. There's going to be multiple order of draws in your life, but this is the one we follow for the exam. Okay. And remember what we stated in lecture, yellow right here goes up top here with the culture bottles. And you don't do culture bottles. I don't even think nursing does culture bottles anymore. Because again, it actually turns into like a mini surgical procedure. But yellow is number one, and then all of these are order of draw. So let's say for example, I'm doing a PT-PTT with chemistry. I know PT-PTT is light blue, and I know my red is chems. So who's going to go first? Whoever's on top. Let's say I have a culture and sensitivity, which is yellow top, and I'm doing glucose as well. So yellow top cultures go first, and then your gray goes second. And that's how you, so know this order of draw for the exam. What's going on? Okay. Next, okay, and of course the sample requisition form. Oh, I should have put that up top. Should have did that first. Let's look at it. This is if you have all the time in the world, and also it's the best way to do it. So I always put, of course, first name, last name as it appears on their insurance card. Okay, that's why most places, one of the first tiles you see on your electronic medical records is their insurance card. Of course, their date of birth, what time you took it, and the ones in stars are something, and you have your go-to ICD-10 codes, like hypertension is common, diabetes is common, right? Always have your go-to ICD code. Or if they just came in for the sniffles, usually rhinitis, or if they came in for regular physical or office visit, there's a code for that as well. What I like doing in real life is I have this little card, I laminate it or you know whatever, and I put it right next to my lab, so I know, like if I know my patient came in and they came in for the flu, right? They came in for the flu. Um, uh, um, I have a code, and this star is important. Your physician, remember I told you about the TrueDats. Your physician has to sign. Okay. All right. Okay. Make sure you know the checks are, you know, they don't smudge into the other lines, and make sure that it is clear on what your doctor ordered. If not, you have to ask. Okay. So that is it goes, that is your phlebotomy procedure. Now I'm going to log off and then log on again because that's the only way I can get separate videos, because I want a separate video for your phlebotomy procedures as a separate video for EKG. And lastly, we'll go over your analysis. So kindly log off and log back in like 1 minute so I can reset the recorder to record another session. Alrighty, I'll see you in about a minute.